I, Bipasha Yogi, Student Manager of BIIB, welcome Mr. Nitin Deshpande to this 10th National HR Meet. Sir is responsible for managing all day-to-day operations of the India entity of Allscript. He joined the company in early 2007 when he set up the Pune office for the erstwhile Eclipse Corporation, which merged into Allscript in 2010. He has helped the company grow the operation from 100 to 1700 in 5 years. Sir came in Allscript from BMC Software, an enterprise management software provider, where he served as President and Chief Executive Officer of the company's operation in India. In this role, he was responsible for planning the long-term growth of the center, research and development, support, operations team in finance and account, facilities, human resource, marketing, and information technology support. During his stay at BMC, Sir grew the organization from 200 to approximately 900 employees in 3 years. Prior to BMC, Sir managed all the strategic business units and delivered support function at Geometric Limited, a provider of product lifecycle management and product development management services and solutions. Sir has also worked at Satyam Computer Service Limited, a leading global consulting and IT service company. In a career spanning of 30 years, Sir had a 12-year entrepreneurial stint that included founding companies in India and Canada with clientele across North America. Sir received a bachelor's degree in electrical engineering from Indian Institute of Technology, Bombay, and Masters of Business Administration from Indian Institute of Management, Ahmedabad. He has been a chairman of the Indo-American Chamber of Commerce, Pune branch, and also a chairman of Software Exporter Association of Pune. He is a founder chairman of Mood Indigo Foundation, an NGO founded by his IIT B classmates from Pune, doing work in the field of education for underprivileged children. Thank you, sir, for coming over here and accepting our invitation. And now the podium is all yours.
Good afternoon, and thank you very much for having me here. Don't worry, this lack of visibility will not be there on the further slides. So, first of all, it's a great pleasure to be here. I have met Dr. Inamdar after several years. So when he invited me for this session, the only question I had was that, this is an HR forum and what will I talk about? Because I'm more into healthcare IT now, but he suggested that it's always good to have different ideas, and there's an element of HR in everything, so why don't you come? So here I am. So I will start. What I've done is I'm going to talk a little bit about the domain we are in, which is healthcare IT, and essentially I'm going to try and explain to you how IT can change healthcare in the world, and why it is important and what are the new trends. So first of all, before I do that, let me introduce Allscript, which is the company I belong to. The reason is not to plug that company, but basically to kind of give you an idea and the context as to what we do. So as you can see on the screen, we call ourselves, our tagline is Connected Community of Health. Now what that means is, because we have so many different doctors, and mostly in the US, but we are growing in other areas now, so almost 180,000 doctors, which is 1 in 3 in the US. So if you think about it, if you just randomly, somebody went to a doctor in the US, the chances are 1 in 3 that the doctor will be using our software. Almost 1,500 hospitals use our software, and 10,000 or more what we call post-acute care organizations. Post-acute care, just to simplify the term, acute care is when you are in the hospital. Post-acute care is where you come out of the hospital, but you still need some health care. So it could be a rehab session, rehabilitation, physiotherapy, or it could be just home care. So that also about 10,000 of them. And actually our software is used for more than 30,000 home care visits per day. So that's why it's, we feel that we can actually live up to this thing about connected community of health. So that's what we are. So let's talk a little bit about the challenges that we have in the world today. So there's a whole bunch of different things that are happening in the world today, and some of the trends are like this. So while the slide is not coming up, let me just tell you a little bit about it. So first challenge in the world today is the growing or aging population. So as any idea as to what the growth is like? Because on one hand, healthcare is actually making our lives longer and longer, and therefore what's happening is, in 2000, there were about 600 million people in the world who are above the age of 60. 600 million, all right? By 2050, that number, people above 60 years of age, is going to grow to a whopping 2.5 billion. You can imagine now, even today, if you look at the healthcare costs in any economy, 80% of the cost of healthcare is actually borne by, or is meant towards people who are aging, 60 plus. So if you have 2.5 billion people, you can imagine the kind of cost implication it's going to have. But you would imagine that if that's the kind of growth, then you should be having more and more doctors, right? The fact that you are all sitting here in the management institutes, you obviously chose or decided not to go become a doctor. I have several friends who are all doctors, both couples are doctors, but today their children are saying we don't want to become doctors. There are various reasons, and I don't want to go into the details of that. But because of that, the scary thought is, today the US has about 24 doctors per 1,000 people. Okay, 24 per 1,000. In India it is only 6 per 1,000. Okay, and now on one hand, the population that needs healthcare is going to grow, but not enough people are becoming doctors. In fact, in some parts of Africa, it is less than 1 per 1,000. So that's a scary thought for the world in general, right? The other third effect which is coming up is, as the world becomes more prosperous, and we are seeing that in India more and more, earlier the major diseases which caused fatalities were what we call infectious diseases. You know, you have all heard of the big plague and the malarias and TBs and all of that, which used to take a lot of people away from us. And Malthus has this theory of population, right, where he talks about how whenever there's a lot of population, some other scourge will come and the population comes down. Now with better and better healthcare, what's happening is, it's on one hand it's very assuring, but on the other hand, what we call lifestyle diseases, those are becoming more and more the bigger killers. The lifestyle diseases which are based on the fact that we are more prosperous, therefore we have less activity, therefore people become more obese, and there are all these things like diabetes, hypertension, heart disease. These are the ones which are really causing problems now. In fact, by 2030, the World Health Organization estimates that more people are going to die of lifestyle diseases than of infectious diseases. Right? Because infections we can control, lifestyle diseases requires a different kind of an attitude. So that's a huge challenge again. And finally, and probably the most importantly, cost of healthcare is going up tremendously in every part of the world. Now in the US, actually globally, not just in the US, in 2000, the total cost on healthcare which was spent was about $3 trillion. Okay, large number, but nothing. It's only about 0.5% of the global GDP, right? In 2021, the estimate is the cost on healthcare will be $14 trillion. And in the meanwhile, the GDP will grow, but it will only double. What does it mean? Healthcare cost is going to become 12% of world's GDP. Now, where are we going to spend other things? If we need infrastructure, we need all other things. Where is that money going to come from? Therefore, it's absolutely imperative, given all these facts, whether it is the aging population, whether it is the number of doctors available, whether it is the lifestyle diseases going up, and of course the healthcare costs going up. These are the trends which definitely mean that we have to do something differently. The way we have been attacking healthcare in the past is not going to work any longer. So we need to have something which is better. And that's where we talk about some other things like, how is IT going to help? The other thing which is very interesting is that this is a chart And what it shows is the life expectancy. And this is sort of supporting to the part that I talked about earlier, where I said that the populations are aging. So what's going to happen is, there are lots of areas, particularly you see the reds and the oranges. So Africa, most part of South Asia, most parts of Russia and other allied countries. These are the places where there's this huge problem of life expectancy. But that is also gives us a big advantage. We may think that this is a problem. We have lesser resources and therefore we cannot do as much. However, in these countries, we have one major advantage, and that advantage is that we are starting fresh. So, what does this tower remind you of? What is this? Right. So, I want to take an analogy from this industry which we all know very well. You have seen this industry transform in your lifetime. Right? It's completely changed. And how has it changed? So, this is what the difference is. In 1991, we had about 900 million people in India, and we had how many phones? Just 5 million phones, right? In fact, I remember, when I was growing up, there were no phones of any kind. Forget mobile phones, but no phones of any kind, even in our neighborhood. And to apply for a phone, you had to wait for like 20 years or whatever. Now, we have a population of about 1.2 billion, right? How many phones? 960 million phones. So from 3% of India's villages having phones, today we are at a stage where almost everybody has a phone. Now that's a tremendous achievement. It's like a revolution, right? It's not something which, and at the same time the cost has dropped so much that anybody and everybody can afford the phone now, right? So I still remember the first time I got a mobile phone, maybe about, 12, no, more than that, about 15 years ago. My parents live in Nagpur, which happens to be in the same state as this, but even to call them, or even to receive a call from them, forget about calling them. If they called me, I had to immediately tell them, is it something urgent? Otherwise I don't want to talk, because at peak time, the rate was 32 rupees 80 paise per minute. Right? Today, for most of the purposes within the circle, it might even be free because of the packages that you have. Or even if it's charged like 30 paise. So that's the kind of a difference, and that's what has made it possible for everybody to have a phone, and therefore, even in remote areas, you have this whole possibility of. So why are we talking about this? We were talking about healthcare. Now, how have we suddenly jumped to the telecommunications revolution? The idea is that what has enabled this rapid revolution? It is the evolution of technology. Because the mobile phones did not require us to actually lay down the copper pipes and all of that, which was a big problem earlier, we didn't have the resources to do that, this was possible. We believe that this is also possible in healthcare. And that's the only way. Only if you use technology in the right way can you actually tackle the challenges that we talked about earlier. So what are these big trends in healthcare? So let's look at some of the major trends. And I hope this slide works now. Okay. So the first trend, and I'm going to go into details of each one of them, but the first trend is Tele Health. Okay, and I'll explain what this is. The second is mobile health. All right. Third is social media. Fourth is information clarity. And fifth is real-time analytics. So these sound like big words, but let me just try and explain what each one of these means and why I think that healthcare is going to be transformed by using these technologies. So the first one, that's called telehealth. Now, for telehealth, it is, it has really evolved in these recent years. So it's not just telemedicine, but it's a wide variety of technologies, and it really extends the reach of the care providers. Care providers would be, doctors, physicians, nurses, and so on. It actually extends their reach by overcoming the physical limitations of geography. The biggest challenge is, we always talk about what is the nearest hospital, where is the nearest primary health center, and so on. And in a country like India, it's a huge challenge, because people can't even get there and people die before they reach a hospital. Now, fortunately, telephone technology or telecommunications technology has reached all the rural areas as we saw earlier. Therefore, if we combine this technology with medicine, then we can have telehealth, and we can essentially have a small number of care providers dealing with either, let's say, delivering care or even monitoring the health of many more people, including those who would otherwise be completely denied that quality care. So this is a huge advantage. So let's look at some examples of this. It's not just a dream. So ATNF, that's Apollo Telemedicine Networking Foundation, right here in India. This is not something which I'm talking about from the US. Right here in India, ATNF is a not-for-profit organization which has been made by the Apollo Hospitals Group, and they are doing this in a big way. So what Apollo is doing, and this is just a news report on what they are doing, so they are the single largest telemedicine provider now. They have over 125 centers, telemedicine centers or telehealth centers, including 10 which are overseas, not just in India. Okay? And they have apparently done more than 71,000 teleconsultations, where the doctor is actually connected to the patient over the telephone line. And as far as away as 7,500 kilometers. I sometimes joke about my sister, she's been living here for quite some time, but sometimes if a daughter has some problem or something, she will not go to a doctor here. She will first call up our cousin who's a pediatrician in Nagpur and only talk to him. And when I tell her, why don't you just show her to some local doctor? She says, no. That's the person I trust. So I said, okay, but how will he know what the symptoms are? She said, well, I make her speak to him, and nowadays I just take a photo on my mobile phone and transmit it over email, and then he can figure out what's happening. Now, this is a kind of a telehealth at my home, but that trend is something, because of technology, is really growing. And if you consider the fact that you have now cameras, in fact, Nokia has recently had a camera which had something like some crazy 41 megapixel or something. So that kind of a phone. And most phones have, like nowadays 6 megapixel or 8 megapixel and so on. And tablets, of course, everybody has started going for tablets. So what is starting to happen is that people are connected, people have cameras, and that is extending this telehealth thing even further. I'll just tell you a quick story. So my CEO, who's in the US, so his son plays American football, and he got onto a flight. They were to catch a flight to go somewhere. He had just come back from a match, and suddenly he noticed that his son's fingers were badly bruised. And he said, what happened? He said, oh, I had a little accident on the football field yesterday. So while they were in the flight, before the flight took off, he immediately took a picture, sent it by email to his doctor, because he was not sure whether it's going to get worse. They were going to go to some remote place for camping or something. They wouldn't have got any doctor, forget about doctor, they wouldn't have got connectivity also to be able to converse. So he did that, and while they were in the flight was also enabled with Wi-Fi. So they conversed with each other over the flight. He had his iPad. So on that phone, using the phone camera, while they were in the flight, he could actually talk to the doctor. The doctor saw exactly what was happening. And by the time they landed at the airport, he had everything, the prescription and what was to be done ready. And this is all across a 1-hour flight from wherever, from Chicago to some place in Alaska. So this is what is possible today if you have the connection. Now obviously these things are not available for everybody, but the point is that this can really change and we can see how it will change further. So another example of telehealth. Okay, this is monitoring patients from a distance. So we have, in India we have been having this monitoring thing as our expertise for quite some time. A lot of you may be aware that a whole bunch of people, technical people, sit in offices in India and monitor data centers across the world. We call it remote infrastructure management, right? Now the point is, it's one thing to monitor, say what's happening to a database, whether it's going to crash, whether it's, some errors are coming in some IP protocol somewhere. That's on the technology side, on the IT side. Now, why can't we use the same thing for monitoring patients remotely? Now that's something which is now catching up. In fact, we have one company right here in Pune where this company, what they do is they employ a lot of radiologists, and these radiologists are doing telemedicine in a different way. They actually get the scanned, not the scanned images, the actual images in a digital form, and they write the reports here, and it's all online. I mean, these guys are working as radiologists sitting here for the patients in the US. Now that can be extended in a big way to really monitor a large number of patients. One doctor can actually monitor a large number of patients like that. So there's another partnership in India between Fortis Hospitals and GE. And what they do is they provide care to critically ill patients in small towns. And that's through an electronic remote monitoring program called Criti Next, they call it. So that's also something which is happening today. It's not fantasy. And EICU, that's what you see on the screen, EICU. That what they do is there's a command center in Delhi, and that monitors a lot of patients across the whole geography of North India. Then one more example I want to show you. So this is called First Choice Home Health and Hospice. It's one of the largest post-acute providers. I may explain what post-acute is to you. In the state of Utah. Now the state of Utah, for those of you who know geography in the US, it's kind of, it's not really well developed, it's sparsely populated, and it's very difficult for people to get to doctors very quickly. So what they have done is they have deployed remote vitals monitors. Vitals are, all these things like your pulse and blood pressure and these things, glucose level and so on. So what they do is they've given these tools or kits to the patients, and these are at home. The patients just take it themselves. They get automatically transmitted, and a single telehealth nurse can now keep track of 60 patients. So if the nurse finds that something is not absolutely right, then she can actually tell the doctor and immediately try to save the patient before he gets really worse. All right. So these were the two examples of taking more patients. And then if you look further, now this is something futuristic. It is right now has been approved by the FDA in the US. It looks like a pill. It's like a capsule which has been opened. If you can see the picture, it's a capsule which has been opened, but inside the picture, there is actually a micro camera that's sitting inside that capsule. So this FDA in the US has now approved it. What you can do is, if you have any gastrointestinal tract issues like ulcers or suspect or whatever, today the thing is that you have to put some endoscope in. It's pretty painful and uncomfortable to do all that. Now what you do is you swallow this capsule, just like you swallow any other capsule. What it does is, as it moves down, it actually takes pictures of your GI tract from inside, transmits it wirelessly to a receiving equipment, and the doctor can actually see, the whole thing is recorded, and you can actually see what exactly is going to happen, where the problem is, without having to do anything painful. So this is another example which is going to completely transform, and this is just the beginning. There will be other things which will now be brought up. So this is another example of sort of telehealth, where it's not just telephone, but this is now camera being, and the material of which that camera is made is also something which is digestible and not affecting the health. So these are really exciting times. All right, next we go to the next trend, which is the mobile health. We talked about telehealth. Now let's talk about the mobile health. Now, in mobile health, we move from technologies that empower or expand the capabilities of providers to technologies that empower and engage patients in their own care. So one example. So My Care team is a software platform. So what we have done is we have created this platform around what we call Allscript's electronic health record. So what it does is, there's a glucose monitor, and these are fairly common these days. So there's a blood glucose monitor, and that blood glucose monitor can directly transmit the readings into the electronic health record. Electronic health record is the repository of all the details related to a patient, right? So it just transmits it to that, and it also tracks their progress on diet and exercise. So it's a combined tool which tracks on one hand. Some of you might have smartphones where you have either an Android or iPhone or whatever. So they already have gadgets where you can track exactly how much exercise, how many steps you are taking, how much you are running, what your BP is, what your heart rate is, and those kind of things with some attachments to that. So this is similar, and all this is being kind of transmitted, and then therefore what will happen is you will have the caregivers, that is the doctors or the nurses, they can easily monitor the patient's progress against the treatment plan. So as the treatment is being modified or some dosage is being adjusted, you can actually see live online what is happening to that patient. So the patients can feel much more engaged now on their own health. Some of the severe disparities in Africa and underdeveloped countries in the world. Now again, you can't really reach there. So this is what these kind of technologies are being used. So one example is this M-Pedigree. What is being shown, M-Pedigree. So what they do is, I don't know whether you can see it clearly, but there's a smartphone, and what it's doing is there's a drug, and that drug, it's taking a picture of that drug, and this picture can actually be sent to a predefined number where you can send a free SMS or MMS with that picture. And what it does is, the problem that it's trying to solve is that in these countries, Africa and maybe in India also, there are a huge number of counterfeit medicines, where those medicines really do more harm than good. So what this does is you take a picture, so there's a barcode and all that, it goes across to the manufacturer, and this is a service which is connecting all the manufacturers, and instantly you get back free of charge an SMS which says, is this safe to take this drug or is it a counterfeit drug? Now you can imagine the kind of impact it can have on number of deaths which happen only because of counterfeit medicines. So this is another example of mobile health. Another trend, we all, I don't think you have anybody here who's on, not on social networks, right? Is there anybody who's not on Facebook? Yes, raise your hand. Okay. So one thing we got to admit is that things like Facebook, Twitter, etc. are here to stay. Now while one can debate about some of the ill effects that it may have, but there are several good things which happen because of that. So one of the things that is happening is, we are trying to track things like what they call epidemiology. So epidemiology is, where you try to analyze how an epidemic spreads. So earlier days, if there was an outbreak of, let's say, some kind of a disease, infectious disease, what people would have to do is, actually epidemiologists would go to that area and then kind of start taking samples and hope that they figure out how the disease is spreading and why it started there. Today, there are some technologies which are coming up. So Kazemil is one such Japanese technology. So what they do is actually just a software tool. What they do is they monitor Twitter. And while monitoring Twitter, they kind of sparse the tweets that are coming for symptoms of a particular kind of a disease. And typically most people are on social network, and if somebody is not well, he would probably tweet with some symptoms. Oh, I'm having a sore throat today, right? And things like that. So these guys actually capture that, and from that they try to create a map depending on where the tweets are originating, because you also know the location of the patient who's saying this. And that way they are actually in a real-time mode, graphically. Actually the picture that you see on the left hand side is a graph of Tokyo and the tweets which are coming on a particular kind of a disease. And they kind of map it as to how it is spread, where it is right now, how it is moving, and it's animated. So it will keep moving over a period of time. So you know how that thing is spreading. So this is one example. The other example on the right is healthmap.org. And what they do is they monitor social media again to deliver real-time intelligence on a broad range of emerging infectious diseases for a diverse audience. So this audience could be local health departments, governments, international travelers. If some kind of a disease is more prevalent in one particular area, then it can be advisory for the international travelers and so on. So all this has not only great promise for empowering patients to avoid infections, but also it can accelerate the ability of governments and international bodies to respond to such outbreaks, because and this is also going to help into kind of curbing the infectious disease part of it, and therefore we have to focus more, like I said earlier, on the lifestyle diseases. So this is another example of mobile health. The fourth trend is information clarity. Now you can see on the picture that there are a whole bunch of different entities in this in the healthcare. So you have the public health systems, home care, you have laboratories, you have small physicians' offices, single doctor kind of offices, you have large hospitals and so on, and the pharmacy, which is like a chemist shop. Okay, but the problem is that all the information is now coming up. Various people are using healthcare information, but it's not one view. So what we have to do is we have to create one single view, and that's not easy. So one of our clients, a client called Orlando Health, they're in Florida, and they have a really nice health system. So what they've done is they have 6 hospitals covering about 2,000 beds. So you can imagine the number of patients who come there. 350 employed doctors and hundreds more who are independent but who refer patients to this hospital chain. So what they did was they have tied up with all these entities, right from the pharmacies and independent physicians and so on, and they have different systems running, different IT systems running in different hospitals, but they've created something we call a Allscript community record, and all the information comes into one single record so that whoever is treating that patient has a complete picture, and that picture looks something like this. So this is, again, it may not be very visible, but let me just tell you, what it does is, doesn't matter where the person got some treatment, whether he was given some injection or given some medicine or he had a bout of some attack, all that is actually shown in the form of a timeline. Just like you have Facebook timeline, this is a timeline day by day, hour by hour, as to exactly what was happening, and it can show everything. It can show the temperature, how it was moving, what drug was given where, after that how did the temperature come down, the input, output, everything, all in one shot. So what happens is, no matter where that patient goes, whether he's in a hospital setting, whether he's in a single doctor setting, or he comes out and comes home, all the information is available to the treating doctor remotely or in person in one shot. So that's another thing which is a huge issue, because typically earlier one system would not talk to another system. They were all disparate systems. So now by doing this integration, you can actually get one single view. And that brings us to the last trend, which is real-time analytics. Analytics, as some of you would probably have learned, is typically sort of what we call post-mortem. Now, post-mortem is not a very nice word to be used in the healthcare context, because post-mortem literally means after death. But what we mean by post-mortem is, after the fact. So analytics typically works after the fact, and then you try to mine some information and mine some trends in that. However, it's really what is changing now is what we are coming to what we call real-time analytics. So what does it mean, real-time analytics? So, we try and keep analyzing things as they happen so that we can make it predictive analytics. Rather than reactive, it's predictive. So one example of that is, there's a university called University of Kentucky where they use one of our software. And what they've done is they've created an early warning system using analytics. So what happens is, the moment any vital signs are being monitored in the hospital for any patient, that information keeps getting fed automatically into the acute care electronic health record. And then it calculates, using analytics, it calculates a kind of a score and some triggers. If this is happening and this is happening and this is happening, then automatically it means that there's a risk of this patient developing some problem. So a simple example, not this, very simplistic, is if the temperature is started to rise, and if it's crossed 1 degree, in the last, let's say, 1 hour, then you know that you have to do something. But for that you don't need analytics. But it may be more complex than that. It may be a combination of temperature, input, output, it may be blood pressure and so on. So all that, so what it does is, earlier they found out, by doing the analysis, they found out that earlier, if a patient was diagnosed with something and was treated after, say, 10 hours, now the same thing can happen in less than an hour. And that has made a huge difference to the number of complications that they used to have in their hospital, and therefore the kind of outcomes that they are able to deliver. So this is basically, now we are saying you move away from doing it after the fact and try to keep the patient healthy before he becomes too serious. And that's what ultimately the goal should be. Finally, what's happening is, because of all these exciting things, the good news is that investments are also rising in this. A lot of you are, studying international business and so on. So you may have read this, that you look at the GDP growth. India is expected to grow by about 100% in the next 10 years, right? I hope that is true, but that's the expectation. At the same time, the real healthcare spending is going to go up by 140%. China is going to go up by 167%. So everywhere, people have realized, in fact, in the 12-13 budget, Indian government has already increased the spending by 25%. And Indonesia, Vietnam, you name it, all these countries are now really beginning to realize that you need to invest in these technologies if you really want to tackle the problems that the world is going to have in terms of giving affordable healthcare. Finally, innovation. You know, if we don't embrace all these, then we will not be able to achieve. You saw the scary numbers in terms of the patients and the kind of healthcare costs which are there. The US is already about to go bankrupt if they don't do something about it, and that's why Obamacare is becoming such a hot topic in the election year there. But everywhere in the world, we have to realize that governments will have to remain open to figuring out what are the better means of delivering care, and IT and technology is going to play a huge role in that. And that's how we are going to see a completely different way. Just like the mobile technology has revolutionized it in our lifetime, you will see that in your lifetime, healthcare and the way it is delivered is also will be revolutionized very soon. So that's all I wanted to talk about. So thank you very much, and I can take questions.